Hello, Edutainment Studios and Access Healthcare welcome you to Cervical Cancer Prevention Guidelines. This module is part 3 of a 3-part series on the prevention of cervical cancer. The cervix is the lower part of the uterus. Cervical cancer is caused by a virus called HPV. The virus spreads through sexual contact. Sometimes the virus leads to cancer. You're at higher risk if you smoke, have had many children, use birth control pills for a long time, or have HIV infection. Cervical cancer may not cause any symptoms at first. It usually takes several years for normal cells in the cervix to turn into cancer cells. Your healthcare provider can find abnormal cells by doing a Pap test to examine cells from the cervix. You may also have an HPV test. In this course, the objective is to help you know what are some things that you can do to help prevent cervical cancer. In addition to regular testing, there are other ways to help prevent cervical cancer. You can learn about other female cancers. Your Pap test only tests for cell changes in your cervix. It does not check for ovarian, uterine, or other female cancers. If you see or feel anything that is unusual, talk to your doctor. You should quit smoking. Smoking damages your body's cells, including cervical cells. If you smoke and have HPV, you have an increased chance of getting cervical cancer. You can get vaccinated. The HPV vaccine will protect you from high-risk HPV viruses that affect your genital area and can cause cervical cancer. You should always practice safer sex. HPV is spread through any kind of sexual contact, not just intercourse. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Here are some other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of this 3-part series on the prevention of cervical cancer.